Love that song. Love that song. Having a new baby comes with a lot of challenges and a lot of changes. In this episode, I talked to pediatrician Dr. Emeka Obidi, who can help talk to expectant mothers, talk to mothers who've recently delivered, and help them to understand how to care for their newborn baby and what to expect, because that's such a big deal. So they can feel more confident, they can feel empowered, and ultimately enjoy their babies. If you're a new mom, an expectant mom, or if you're someone who is helping a new expectant mother, this is the episode for you. If you're new to me, I'm Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. Here on the channel, I empower, I educate, and I encourage people to take charge of their health and their life, avoid complications, and create the life they've always wanted, go into the next level. You have caught me once again in the middle of Vlogmas. Every December, content creators come aside, they expand, they improve, they grow their content, and they tweak the things that they are doing with the idea of trying to figure out whether they're still serving their purpose and how to get better content to you, our viewing audience. Yeah. And sometimes you get to see it live and in person, right? Like you've seen here multiple times on our show. But the benefit to us is that we get to look at our content, we get to tweak it, we get to refine it. And the benefit to you, our viewers, our patients, our clients, our customers, is that you get better content. So a shout out to all of those who are doing Vlogmas, all my colleagues, all the content creators who are out there. And you see right above me the Vlogmas logo. So if you see that logo on any video, any content that may be in any of the spaces, I want you to go over and drop a note and support and say, hey, I like what you're doing. Now, you may not normally even consume that type of content, right? You may not listen to that type of thing before. But this month, I want you to take a moment and just acknowledge and say to these guys and gals that we really appreciate what you are doing, right? So my hat's off. Here on this channel, I have been highlighting people who are doing their thing in their space. They're not waiting, right? They're not putting it off, but they have something in them, and right where they find themselves, they are making a difference. And you've seen all the people that we have had on so far for the month, and tonight is no exception. And I'll introduce Dr. Obidi here in just a moment. But thank you guys for being here. Thank you gals for being here. If you've not already done so, make sure you go back and you look at the other content that we've done this month. And remember, last month we did a live show every day about diabetes. So that entire group of videos is on the channel, and I'll show you a list of that as we get to the end of the show. All right. Well, without further ado, right? So Dr. Obidi is a board certified pediatrician, and he practices in Maryland. He is the owner of a multi-provider family practice group. He is also CEO of the Newborn Prep Academy, where he runs an online course that helps new expectant or recently delivered moms understand how to care for their newborn baby, what to expect when that baby is here. And this is so that they can be confident and empowered and ultimately enjoy their babies. So let's bring him up on the stage. Dr. Obidi, thank you for joining us.
Hello, Dr. Wood. It is such a pleasure to be here with you this evening. Thank you for having me on.
Oh, man, I've been looking forward to this since I ran into you. I don't know how long ago I ran into your content and saw you. I think it was one of the things that Dr. Una was doing, but I'm glad that you were here.
Thank you so much. I'm honored to be here as well.
Well, question for you, right? And I've been asking everybody this. Have you gotten all your gifts? Are they wrapped and are they under the tree?
Why do you have to ask me that, Dr. Wood? Come on. Got to my heart, reminding me of all the things I haven't done. Ask me that on the 24th at like 11:59.
Man, I know the feeling. I stopped off last night and picked up a gift. I got one more to do, so I understand. But it'll get done, right? It'll get done.
It'll get done. That's the important thing. Santa will come on time, and we'll have a wonderful time.
Right. Well, why don't you go ahead, man, and just take a moment and just introduce yourself to our audience. Tell us a little bit about who you are.
Sure. Dr. Obidi, like you said, I am a pediatrician. And I went to school in Nigeria, which is where I'm originally from. And I always wanted to be a doctor. I can't remember not wanting to be something else. But then again, I'm from Nigeria, and you can only be three things when you're young. You can either be a doctor, a lawyer, or an engineer. So there weren't too many choices. And then I did my residency here in pediatrics out in Brooklyn, New York, your stomping grounds. And that
Woohoo!
was, yeah, many, many moons ago. And moved out here to Western Maryland, Hagerstown, Maryland, shortly after with my lovely wife and our 2 year old, I think, at the time. And that's been like 18 years ago. Um, got a job here at the practice where I still practice here for 10 years before taking over the practice from the retiring previous owner. And it's just been a blast. Yeah. And then more recently, I have delved into some online work and content creation, like we'll probably talk about in just a little bit.
Awesome, awesome. So in Nigeria, you said those three things, right? So those are what everybody's pushed towards. And why physician for you? Why not the other two?
That's really interesting. I'm not sure. My dad is actually an engineer. My mom was a nurse. Maybe that's where it came from. I don't know. But I just remember as a little guy with the neighborhood friends running after frogs and catching them and dissecting them. I know it sounds horrible, but that's my story. And so I've always been interested in biology, and yeah, and I'm not sure why, but I'm glad.
We're glad. All right. So you wanted to be a physician, and what was the course like to get to be a physician in Nigeria?
So it's a British system. So instead of doing a first degree for 4 years or so, and then go on to med school, you really go right into med school from high school. So you do all the qualifying exams and go right into med school, but it ends up being a 6 year program. So you do your 6 years, and then you graduate with some sort of provisional medical license, and then you do a 1 year internship um, in a teaching hospital before you get a full license. And during that year of internship, is kind of instrumental to me being a pediatrician. You get to do 3 months in the four major specialties. So 3 months in OBGYN, 3 months in medicine, 3 months in surgery, and 3 months in pediatrics. And prior to starting my internship year, I actually wanted to be an ophthalmologist. I just thought the eye was a beautiful thing. I enjoyed studying it. We had a family friend who was an ophthalmologist that had her own private practice and allowed me come hang out with her during my vacation time in med school. So I really was sure that was what I wanted to do. And then I did this internship year and did my 3 years in pediatrics, and just out of nowhere, completely blindsided me, like they said, fell in love with pediatrics. It was such a magical time, and it wasn't necessarily an easy time because again, this is a developing country, so there were quite a lot of unfortunate incidences with kids who probably would have survived if they were in a better resourced country, but didn't make it. But still, it was just such a beautiful 3 months. I felt so fulfilled. I thoroughly enjoyed caring for little ones. And so pediatrics it was for me after that.
Love it, love it. And so when you came to the United States, did you go directly to Maryland, or what was that transition like from Nigeria?
Yeah, sure. I actually ended up in New York because I had a sister, a younger sister, but who had come to college here, who was in New York. So, and I also had like some uncles and aunts in New York. So that was the landing spot. Prepared for the USLME exams, all the three different parts, and the clinical skills assessment, and got all that done. And then I had this sort of gap before the next match for residency. And so ended up actually doing a master's in public health at Columbia University with a concentration in maternal and child health. And that was a beautiful time as well. It was probably the first inkling of wanting to do something outside of traditional medicine because I had this whole year that I had, done this course in public health, which wasn't clinical work per se, but still health related. Lots of teaching, lots of designing, research, social research, going out to the community, to community organizations, and designing questionnaires and instruments to measure what they were doing. And I actually found it very fascinating. It was a nice breath of fresh air from medical school. Um, that was probably some seeds of doing other things other than clinical medicine. That was probably where that was planted. And then so I did that, eventually got into residency in New York as well. I matched in New York, and did the program, completely done, and started to look for work afterwards. Worked as a hospitalist for 1 year at Beth Israel in New York City, and then started to look for something else. We had a friend in Baltimore, and I said, you know what? This job in Hagerstown isn't too far away from him. It's like an hour and a half. That would be wonderful. I mean, in New York, you could be on the train from like Brooklyn to the Bronx and spend an hour, hour and a half, and so that's just the cost of a day. And so, oh, that's very close. We should just move there. We can get to have another friend close to us. And so we moved out here, and I probably see him like once every 3 years. Now, like the local to traveling like more than 30 minutes is a chore.
Awesome, awesome. Yeah, it is that area, Maryland, New York, Connecticut, DC, Jersey. Interesting area to be in. So, but yeah, that's right. You're in my neck of the woods, down there in Brooklyn. Yay! Shout out to Brooklyn. Hey guys. So, so you finished the residency, and you changed, right? So you started out wanting to do ophthalmology. Now we're doing pediatrics. We moved to the United States. We're in Brooklyn, and you do this master's, kind of this gap year almost. Tell us, what did you learn during that time? You said, yeah, this was the kind of inkling of what you were to do. And the reason I asked that question is that there are some people out there who, they're in that position right now, or something has gone on where they're not taking the traditional path and they're discouraged. What do you say to that person?
Oh, that is such a great question, because if you had told me that that year would, and I actually still think that there's so many things I learned during that program that I still haven't implemented yet. Um, but yeah, I think, going back to your original question, I think, first of all, it was, I think, uh, I started to see how you can affect health and have an impact outside of the clinical room, outside of the medical office or medical establishment, right? And again, concentration was maternal and child health. So there were these local organizations, I can't even remember the names anymore, where we would go in to see how they were performing and design instruments to measure if what they were trying to accomplish, if that actually happened. I got an internship with one of the professors, who had a really large funding from the Gates Foundation to do some maternal child health programs in West Africa, and didn't get to travel out there, but it was still interesting to see just the other ways you can provide value and improve the health of a population outside of them coming to see a physician in the office. Um, yeah, I think also just the fact that I actually enjoy doing non-clinical work as well, which I think I wouldn't have known otherwise if I hadn't done that gap year and done something outside of just straightforward traditional medicine.
Wow, wow. Yeah, and there is a colleague of ours who is pushing that you can do other things. As a physician,
Yeah,
you can do other things in your life. You're not limited to that.
absolutely.
That's a whole nother conversation that we'll have at some point. Okay, so what? So you did you join a medical practice, or did you start a practice?
I joined a medical practice. So I joined a medical practice. He was a pediatrician who was actually the second owner of the practice. The practice itself has been here for over 30 years. and he was second owner. I joined him and another pediatrician and worked here for 10 years. And then he kind of, was time to retire and offered the practice for sale. And yeah, and I was already thinking of doing something, but maybe starting the practice. That's a whole other story how that came to be. But so happened that this became available. And so I have been running the practice as an owner and CEO for this would be my ninth year come February.
Wow. So 9 years. And
Yeah,
so I'm
crazy how
sure
time
there's a,
flies.
yeah, I'm sure there's a whole host of things in that process of being the owner now of the practice that
Oh
you can
boy.
share and tell other people about. But one of the things that always interests me is what do people feel? Because you went from being an employee to now it's your baby, right?
Yeah.
And what was that kind of thought process? What was that like? What did it feel like as you were about to step into this new role?
It was scary. It was exciting to know that I'll have full control of what the culture looks like, what the practice looks like, what gets to happen here. But it was also scary because, as you well know, that is one aspect of medical training that is sorely lacking, right? No one teaches you how to the business of medicine. And so it's been a huge learning curve for me this past 8, 9 years. I'm probably only really beginning to settle into that role and fully understand all the things that are required of a CEO. So it's been a long learning process. And there are probably many, many days I wish I were employed again. Thankfully, just a few far between now.
Right, right.
Yeah.
What I mean, just tell us a moment. What as you think back over the last 9 years, right? And we don't want specifics about patients and so forth, but are there any stories of success with the patients that you see, right? And we'll talk a little bit about what you're doing currently. That you say, okay, yeah, this is why I went into medicine.
Oh, absolutely. I mean, just one of my passions for the practice and what I drum with our team members all the time is just creating an atmosphere where people feel welcome and where people are appreciated, where people do not feel they're just a number or feel like they're treated differently if they drove in with a Mercedes Benz as opposed to walk a mile or so to get here. It didn't really matter. They were just valued as a human being, and I think I would like to say we've done a pretty good job of creating a wonderful atmosphere for our patients and giving them good clinical medical care as well. And one of the joys of being a pediatrician, and especially when you've been doing it as long as I have, which is now 18 years and counting, I have so many patients who are now bringing their kids back to me, and that is just wild. It's fun, it's exciting, it's also scary that I'm that old. But it's wonderful, right? When you're walking with this newborn baby, and I don't know, just like years flash before your eyes. You remember all the visits that they came in with their parents and all the different issues you walked through. And yeah, it's just it's very very rewarding, very very much so. And you get to see the difference you make in lives. And of course, as with pediatrics, you're not just dealing with the kids, but you're also dealing with the family as well, right? And so that's fun too.
Right. Okay. And so right now you're in the creator space, okay? And you're in the online, the social media space. Over the years, as you thought about your practice, right? What things did you think you were doing well, or what things did you see in the industry, right? Not necessarily in your practice, but in the industry that were lacking, that was needed for newborns, for moms, for the families that you talk about seeing. Tell us a little bit about that.
Yeah, I don't know if I necessarily approached it that way. I just, through a lot of personal growth work and getting to understand myself and what I enjoy doing and what lights me up, got to really understand or recognize that although I love all of pediatrics and still do, and it's just every age group that I get to take care of just has its own beautiful, magical thing about it. I don't know. Even just with the young adults that I take care of, I see patients up to 23 years of age, and but recognize that I still really enjoyed that interaction with newborns and their moms and dads, and especially that first mom that's coming with this fragile thing, looking thin, and all the million questions that she has. And so I think I recognized that was an area I really enjoyed. And then I sort of, just through some coaching communities that I was a part of, started to realize that there was actually a lot you can do to impact people outside of in an online space, and um, didn't even really know that there were lots of courses out there or online creation. I mean, the whole lingo, even just say the creator, that was completely foreign to me. But knew that I had, seen people who were doing interesting things. And I mean, actually, the one lady who actually I saw doing something online that sparked that idea, actually owned a cleaning business or a commercial cleaning business, and she was creating a course to teach other commercial cleaners how to run a commercial cleaning company. And I was like, that is fascinating that you can sort of go beyond what you're doing in your brick and mortar and affect more lives. And I was like, I wonder what else I do that will just be beautiful to be able to expand the reach and the impact. And then just realize, again, that was sort of the same time I was realizing my passion for newborns and newborn care, and realized that would just be so cool to be able to create something that is of true value. Because over the years, I've seen moms and dads as well, but especially moms, and especially that first mom coming to the office with their newborn with 1,001 questions. And one of the things I've realized over the years is that a lot of those questions actually didn't even need to cause as much anxiety as it was causing them if they knew about the situation or the possible, they knew about this issue prior to the baby arriving. Just really simple things. And so I thought it would be of real value, and I didn't really see, or at least at the time, know of any other courses that did that. And so thought it was going to be of real value to be able to provide this information ahead of time so moms can be better educated, so they can feel more confident. Because one thing I saw over the years was that it really made a big difference in how confident they were caring for the newborns, and especially also how much more they enjoyed their newborns, because there was less time spent worrying about if the newborn was well, if this issue they've noticed or has come about, if it's affecting the newborn or not, if they are feeding well, if there's just 1,001 questions. And so just realize how much of a value it will be to have that ahead of time. And so worked on that content, and now have the newborn preparation course that lays all that out, all the things that that really help mom, and also just creating content online to be able to educate and show moms all the little things that they worry about, so they can know that ahead of time and not worry, and just feel more confident with what they're doing.
Man, that's so exciting to me because my son is old now, but I thought at one time I was like, okay, are they? So we had our kid when I was just actually finishing residency, and so I did med ped, so I'd been in the clinic seeing, right, and then I thought to myself when they brought my son, they're like, I said, are they really gonna let me take him home? Right? Are they gonna let me just take this?
And
this
you're a
person?
doctor, right?
Right, and I'm the doctor. So
I
it's a
totally get you. I mean, I can't remember how many times I woke up to just look at our daughter to make sure she was breathing. I mean, she's 19 years old now. It's crazy. And the first time she had a fever, I was still in residency. I was probably a third year resident and came home from an overnight shift and, had my wife all frazzled that, she has a fever, took her temperature was 102 or 103 or something, took her vitals, and her heart rate was like 180 or something. I was like, oh my God, she's going to die. Let's rush to the ER. And off we go, rushing to the ER, busting through the doors. You guys need to her heart is like racing. It's 180 or 200 or whatever it was. I know, like, Dr. Obidi, she has a fever. Of course, she's going to have tachycardia. I'm like, actually, that is true. That's physiology.
Right.
All right, sure. Give her ibuprofen and then, it's just
So
crazy. But
it
yeah.
so I mean, and you asked me, you said, and so you're the doctor, so I can imagine, right? 'Cause- and we've seen it. You've seen it in your clinic.
Mhm.
The person who comes into the medical space who doesn't know the lingo,
Mhm.
who doesn't know the procedures, doesn't know how the things run in the office, right? And sometimes in medicine, right? And I'm gonna put myself in there. We assume that just because it comes that easy to us, that it comes that easy to the mom,
Yeah.
and it doesn't.
That is so true, so true. And I was just telling this to someone the other day, like when just in everyday interaction with a patient, if I tell them some information or pass on something or, give them a diagnosis and a treatment plan, I am so tuned right now at this point to notice the facial expression that tells me, I don't understand what you just said, but I'm going to nod and say yes. Say, time out, time out. I can see on your face that you have a question there, or there's something not landing well for you. Tell me what it is. I never let them leave. I dig in, and they always come up with something, right? Yeah, well, I wasn't sure about this or that or the other, or explain this again. And so you just imagine how many times if we're not careful, and I'm sure I probably even missed that cue many times, right? And they leave, and you think they knew exactly what you said, and that all went over their head, but they just, felt uncomfortable bringing it up. Just for various reasons, right? And so, yes, so totally to agree with you there.
Do you find any cultural differences in how moms may respond or how they interact with the in the medical space?
Yeah, I think it's even more so you really have to be, and this would be to my physician colleagues out there who might be listening to this, you really have to be very in tune whenever you are have a patient who is not native born in the States and who is first generation immigrant, because many of them come from cultures where the doctor can do no wrong, or the doctor, even if he does wrong, cannot be questioned. And so they will be extremely hesitant to ask any questions, bring up any hesitations, or they do not understand or do not agree. They will very often not say anything, and they'll smile and they'll say thank you. And if you're not careful to look out for the little cues that it just went over their head, or they really haven't accepted what you're saying, you'll miss it. Yeah, and it's certainly this case, I'm sure, with native born Americans as well, but especially, there's definitely a cultural difference for sure.
Right, right. Wow. So tell us a little bit about this course that you have. What are moms learning? Um, how does it work? Tell us, walk us through that a little bit.
Sure, sure. So the course itself, it's 4 modules, which you can, take at your pace at this point. Initially, when I thought it was over 4 weeks, and it covers all the basic things that really help a mom be prepared. Of course, I can't cover everything. That would be like, 100 module course. But I find that you don't need to know everything. You really only need to know a few key things that sets you up for success. You need to just understand the whole mindset, first of all, what I call the mindset of a confident mom, right? That just sets you up to be able to, first of all, just care for your newborn. You need to understand that you are the best mom for your baby. And, it may seem like a simple statement, but new moms, that lands for them differently when they sit with that statement to really understand that they're the best mom for their baby and that they're in control of their baby's care, not anybody else, but they are, and that they have all it takes to care for this baby. It's a mindset that takes some journaling and some sitting with to actually get your brain around. Because when a mom gets to that place, she is now confident to know that she can do this, right? There are going to be difficult days. There are going to be days where she's frustrated, where she doesn't understand what's going on. But she is able to approach that from a confident stance. She's able to go after the information she needs from a confident place, knowing that, okay, part of being confident and being secure in this role as a mom taking care of a newborn is that I can go look for the information that's missing. And when I get that information, I can, make the best decision I, feel is right for my baby. And I also reserve the right, like I teach them the course, to change my mind if I get new information down the road that makes me believe otherwise, right? Just, it's so freeing, I think. And I've heard from moms that it is very freeing for them to be able to internalize that. So we go over that. We go over some tips and tricks with breastfeeding and formula feeding and different kinds of formula and all the different issues with that and different issues with breastfeeding and troubleshooting a few things that come up in the exam room with moms that they've worried about with breastfeeding. We talk about their baby's poop and what's normal and what's not. It's simple things. We talk about, I mean, just the other day, I always go over this with every new parent, letting them know that the umbilical cord does not have any nerve endings for pain, but only for temperature and touch. So a baby can tell if something is cold on it or warm. It can tell if you touched it, but it doesn't hurt. That is so freeing. You would not realize how much it is. And over the years, realize something as simple as that. I just did that just 2 days ago. And they're like, what? Are you serious? Really? I can touch it? I'm like, yes, you can touch it. It's not going to hurt. I promise. And I kind of poke it myself, like, see, they're not moving. But that is so great. So we go over things like that, things about how to choose a pediatrician and what to do for the first visit, how to maximize that. Just a bunch of different little things along those lines. Talk about postpartum depression and how to recognize that, how to advocate for yourself and seek help that you might need. And it's really been just beautiful to see how much of a difference it's made for the moms and actually dads who've taken the course as well. That was actually surprising to me that dads were able to resonate with the course as well as moms did, and they didn't really need anything different to get that information.
As you're talking, I'm recounting this commercial, and you probably have seen it, where the mom has the first baby, and the baby's like in all white, and she's being so, careful with the baby, and then she has the second baby, and she hands it to the guy. He's all full of grease. But the reason I like that video or that commercial is that it goes to show that once you know and you're comfortable in your environment, you don't worry as much.
Yes, very much so. So true. Yeah.
Not that we want you to give the baby to the guy with the grease, but
Yes, please don't.
please don't do that, right? But one of the things that you say that you do, you teach them how to care for the newborn and what to expect so they can feel confident, empowered, and they can enjoy their babies. Talk about those three things a little bit for me.
Yeah, so spoke a little bit more about confidence, just the fact that when you're confident, you really are able to better advocate for yourself and your baby. You're better able to recognize their needs. You're better able to trust even your own instincts. I mean, I never brush up a mom that says there's something wrong with this baby. I always look very carefully, make sure I dot all my I's and cross all my T's, because oftentimes there's this intuition, this knowing that a mom has when there's something off. And so, but if you're not confident, you can ignore that, right? So confidence really just plays into all of that, being able to care for this baby and go after that information. Just being less anxious about just knowing what to expect. Like the little example I gave about the umbilical cord, and so many other little things like that, that when you're just better able to show up for your baby and really enjoy your baby, because I've recognized over the years that oftentimes when these things come up, it's not like you have, your pediatrician at your beck and call that is immediately available the second that issue arises, right? You have to wait till the next day, maybe call into the office, wait for an appointment. Maybe you're not quite even sure if to bring it up or not, but you have an appointment coming up in a week, so yeah, I'm going to bring it up then. But in the next 7 days, you're worrying about the issue, right? And just I just felt like there were so many precious moments that you could have enjoyed a baby that was stolen by the worry and the anxiety over what was going on with your baby. And so I really feel like, take the simple example of the umbilical cord again, right? The parent who knows that this doesn't hurt snuggles that baby, like they pull that baby close. Because what happens for most moms is, even when they're breastfeeding, they're careful not to draw that baby too close because they're afraid they're going to hurt the baby, because the umbilical cord is going to be disturbed and the baby will experience pain, right? But the mom who knows that doesn't hurt just pulls that baby close to her, doesn't care about it, right? She knows that even though it looks raw and looks like something that will be painful, she knows it's not. And so just enjoys those moments a little better, right? So I just feel like there's all these small things that crowd up a mom's mind that prevents her from truly enjoying the experience. And of course, it's going to be a difficult experience, not sugarcoating that at all. And I tell them that in the course. But it still makes a difference when you're armed with the right information.
Well, and there's so much richness that can be lost because of little simple things that people don't necessarily understand. So thank you for that example. Now, why online? You said that you saw someone who was doing something online. How did that come about?
I think again, just realize that you just reach more people. You just reach more people. This is information that, doing this for 17 years now and literally caring for thousands and thousands of babies. Just realize that this is widespread. The lack of information is widespread. And yes, they get to eventually get this information after the issue has occurred, but how wonderful it will be to be able to make this available widespread. And no better place to do that than online, right? It's difficult for you to reach as many people when you're physically restrained to your practice and whoever just comes to your practice. And it's been beautiful. I will say, it wasn't easy to venture in because, all these other fears come up about you showing up online and hating the way your voice sounds and the way you look and all those things, right? But it's been a beautiful experience so far.
Awesome. Now, one of the things I meant to say this earlier. So confident, empowered, and enjoy babies. So I love that empowered because that's one of the words that I use when I talk about what I do. So it's a powerful word, giving
Yes,
people
it is.
the ability to make decisions for themselves and to be confident in where they are. So you are a content creator. You are a content creator. Okay. I know that's not
That's
one
what
that
they
you think
say.
about, but there is someone right now who is watching and they watch Dr. Obidi and they are maybe another physician, maybe they're in some other space and they say, well, I can't do that because I'm not like him. There's something special about him that makes him able to get up and talk about people and make content. And how do you speak to that person who may be watching right now?
Oh boy, I think that there are very few people who probably will step into something like this role and feel extremely confident and secure in themselves. I think, truth be told, if most content creators, told you how it was or what the journey has been like, they will all tell you they did it scared initially and they just sort of, got used to it. And I think I was thankfully in a place mentally where I knew that, yes, this was not necessarily going to feel comfortable, but that there's always growth in walking through discomfort. I go back and look at some of my videos from, like, over a year ago. I'm like, oh my God, I look terrible. But you just used to it. I mean, and even for, and especially if, well, I shouldn't say just especially, because whatever you are comfortable doing right now, use, physician as an example. Whatever you're comfortable doing right now, you weren't comfortable at some point, right? We all remember residency and our first year of residency and how very insecure we felt, caring for a patient, right? But at this point, many years out, you can do a lot of it with your eyes closed. I wouldn't suggest you close your eyes, but you just get used to it, right? I mean, I do a Facebook Live now, every Thursday, 12:30 Eastern at the practice, just covering other things other than newborn care. It includes newborn stuff as well, but this is just to the general pediatric population. And I've done it now maybe every week for, it's been maybe 8 months now. It's crazy how time flies. And I just get more and more comfortable. I mean, initially I would prepare for days to do it, and be strung out if my patients just before leading up to it were like, getting too close because I need 30 minutes to prepare for this. And now I can just go from seeing a patient and walk right in and turn on my camera and do the live. As long as I just know what topic I'm going to talk about. And the last one I did, my kids were here. I mean, that would have never happened. There happened to be, it was a weather, there was some bad weather, and so they were home, they were, not in school, and they just came with me to the practice. So they were in there, and they were, heckling me while I was in my live, and I burst out laughing at times and asked them if they wanted to come on. My son came and said hi, and it was his birthday, and I said, say happy birthday to him, and my daughter came, and, like, I would never have done that at the beginning. I would rather die. But you just get used to it. So I really want to encourage, anyone listening um, who has a desire to do something online where they know they can create true impact, to just do it scared. You will definitely get over it. You'll get more comfortable. Yeah, you'll just know that, I think you start to look beyond yourself and look to, the impact you're making and the audience you're speaking to, and just enjoy the process of being able to speak into their lives and provide value for them.
Great, great. Now, no conversation about health or even life in general would be complete without asking how COVID has impacted what you do as a pediatrician, what you did with these moms that were expectant or new moms. Can you talk a little bit about that?
Yeah, this has just been a very difficult year in many ways, right, for all of us, and certainly in the medical community as well. Um, that's a big topic, heavy topic. Things that come to mind is, first of all, it has really been heartbreaking to see how how impactful this has been to the mental health of kids and their families. It really has been heartbreaking. I've had many, many patients whose anxiety had gone through the roof, who still have a difficult time stepping out of the home. Um, as a pediatrician, of course, have seen many kids who suffered, um, um, uh, educationally, just being away from school and struggling through, trying to learn through an online platform. Um, Thankfully, this is one condition that has had a much less impact in terms of the severity of the illness and fatality of it in the pediatric population. So, has been, a blessing in some ways that I haven't had to experience too, many deaths, in my population, my pediatric population, from COVID. There's been a couple, and some of those kids just had chronic disorders they were, dealing with. But yeah, so many has been sad to see. Um, it's been interesting to see how resilient people are and how they've been able to push through this season, and still get things done and still advocate for the kids and still push through and manage, working from home and caring for kids and all of that. And it's been, I think, an interesting period also for us as a practice, going through it. We kept the doors open the whole time. We probably cut hours and scaled back, just for a few short months and not by much. We were open maybe, 3/4 of the length of time the office is open. We're able to pivot to be able to help patient population and online through telehealth, and organize, developed a new system to care for sick kids, shortly after the pandemic started, so that we could check them in from their cars and bring them right into a room. And we still do that till today. So we've been able to care for all of our population. So yeah, it's been quite a couple of years for sure, for sure.
Wow, wow. Well, we are having an amazing conversation with Dr. Obidi about newborn care and expectant moms, and some of the things that he does to help build confidence, to help empower, and to help moms really enjoy their babies, because he's giving them information. But this is a great place for us to jump to our amazing question wheel. So let's do that, and then we'll come back and we will talk with Dr. Obidi again. All right, all right. So if you've been here, you know about our amazing question wheel. You'll see the questions there on the screen. We're going to spin the wheel, and whatever question it lands on, we're going to answer. If you would like your question to show up on the wheel and you'd like to get a shout out, go ahead and send your information or send your question over. And right on the screen, you should see right under my name, Dwayne Wood, MD. Dwayne Wood, MD. You can find us on Facebook, Twitter, Instagram, LinkedIn, any of those social platforms, and of course here on YouTube. You can also send a message to dwood@dwaynewoodmd.com. That's DWOODE at dwaynewoodmd.com. And we will add you to the wheel, and then we'll give you a shout out here on the show. The rules for the question. So I'm going to spin. It's going to land on a question. I'm going to answer the question. So it has to be a usable, practical answer, something that you can take and use in your everyday life. And I've got to answer the question in 45 seconds. Now, if you know me, I tend to be talking in 45 seconds. But we're going to try to do that. And then I'm going to cut that video out of the main show, and I'm going to create a short, a reel, whatever you call it, on all the different platforms. I'm going to post it on those social media platforms, and then I want you to go out and find it. When you find it, I want you to put in the comments, #IWasThere, because you see me create it. If you're watching on the replay, you can do that as well. Put #IWasThere. #IWasThere. Okay, so let's go ahead and let's spin the wheel, and let's see what questions we're answering tonight. And round it goes. Where it stops, I don't know. I keep saying I'm going to get a new phrase to that. How do I treat a low blood sugar? Oh, you know what? That's leftover question. So I'm going to hide that one. I'm going to spin the wheel again, because we answered that one last night, right? So I just didn't take it off. See, that's what happens in the live. There we go. All right, round and round. Okay. Can a type 1 diabetic take a medication like Mounjaro or Ozempic? Can a type 1 diabetic take a medication like Mounjaro or Ozempic? And just some background to those medications. You know, those are the medications that are currently being used both for diabetes management, and also they're being used for weight loss. And there's actually a shortage right now of both of those medications. They tell me Mounjaro is probably going to, well, I won't say that because I don't have official from the company. But anyway, and typically these are medications that type 2 diabetics use, okay? So the question here is, can a type 1 diabetic take a medication like Mounjaro or Ozempic? So let's get our 45 seconds on the screen and our timer. And let me get my thoughts together for that one, first of all. Okay, because this one, yeah. All right. Here's we go. 45 seconds. Can a type 1 diabetic take a medication like Mounjaro or Ozempic? Well, the question here is supposing, I believe, that we want to use it for weight loss. As you know, Mounjaro and Ozempic and those classes of medications are not indicated for patients who have type 1 diabetes. Not that they don't work, but they lower the blood sugar to the point where those patients need to decrease their insulin. And type 1s, they are insulin requiring. So they can use it. They've got to be careful that they don't go down below the amount of insulin that they need to be safe. And let's see, did I get it? Did I do it? I think I did. I think I had a few more seconds left. All right, so there it is. And so you can go ahead and keep an eye out for that. That will show up sometime tomorrow morning after 1 o'clock or thereabouts, okay? So make sure you get out there and remember hashtag I was there. And we are once again talking to Dr. Obidi, and let's hop back over and get back to that conversation. Dr. Obidi, once again, thank you for being with us and sharing such amazing information.
It's been a pleasure. I just enjoyed my time here with you.
All right. Well, any last words for the mom expecting who just had a baby or someone that is in the life of someone who is expecting? Any last words for them?
Yeah, absolutely. I will say that there are no manuals for newborns, right? And that's because also a lot of things that have to do with the care of a newborn can be done many ways. And I think I would love to just speak to that mom and let you know to not worry about if you're getting it right. Get information you need, get educated, speak to a trusted advisor, speak to your pediatrician or your provider, have close family members that you can talk to or friends. But just know that you've got what it takes, that you are the best mom for your baby. You are completely in charge of caring for your baby, and you've got everything it takes to care for that baby confidently. I really want you to feel empowered and truly enjoy your baby and know that they're here for the newborns for this finite amount of time, and don't want you to waste all that time worrying if you're doing it right. Just make the best decision you can and go for it.
Awesome. Love that. Love that. And man, I've enjoyed this conversation. And, as I've been going through this month, it's been amazing to talk to the people who've been on, and you included. I hope you will allow us to bring you back so that we can have more conversations and talk to moms and maybe some other topic. Doesn't have to be a newborn. So
Sure.
I appreciate that.
I would love to be back. I've thoroughly enjoyed this time with you, sir.
Awesome. Well, why don't you take a moment now? So there's somebody who's watching, who will be watching, who wants to know how they can connect with you, how they can see what you're doing. Why don't you share that with them right now?
Sure. You can get everything on my website, newbornprepacademy.com. There's some free resources on there. I have a confident new mom guide that kind of goes through a few things that can start to prepare you for the journey of caring for a newborn. I have a worksheet that walks you through how to choose the right pediatrician for your baby. And you can also access a couple of other resources I have on there. I have a baby prep essentials that goes through a few essential things to get you ready for receiving your baby. And of course, the newborn preparation course that goes through all of the content that certainly gets you confident, empowered, and ready to enjoy your baby. And I can also be found on Instagram at Dr. Obidi, Drobidi, and on Facebook at Dr. Emeka Obidi, Dremeka Obidi. And I'd just love to be able to interact with you. Come on there, send me a DM, reach out. Be happy to help any way I can.
Awesome. Awesome. Well, man, if you would just hang out for a minute, I'm going to close out the show and I'll be back and we'll chat. Okay. Once again, thank you.
Sure thing.
Oh, wow. What an amazing conversation we've been having, and what information. It is challenging, as I said at the top of the show, and it can be, there are a lot of changes that go on. And so having a place where you can learn about what to expect, how to take care of your baby is amazing. And this is a wonderful resource that Dr. Obidi has. And if you are out there, if you're a mom, if you're a new mom, if you're an expectant mom, if you are in the space of a person who has a new baby, a newborn, or is expecting, this would be a great resource for you to point them to. Make sure you go back and watch this video. Give us a thumbs up if you like the content that we're doing. Go back and watch the videos that we've had. And you saw, like I said, you see live in person. You saw me pop up this earlier. So this is just a list of the videos that we've had. As you know, we have been going live every day for the month of December. And then back in the month of November, we went live every day talking about our diabetes care. And if we go all the way back to the month of August, we went live every day as well. And so there are resources out there on everything from diabetes. We did a session that month of August was talking about how to set goals, how to determine what your purpose was, how to say no without feeling guilty. So just a host of things. And of course, last month, talking about Diabetes 101, just walking through all the different aspects of diabetes. You want to make sure that you get back out there and you watch those. If you know someone who needs any of the things that we've done, go ahead and do that as well. And if you've not already done so, go ahead and give us a thumbs up, like I said, and subscribe to our channel. The other thing, let me pull that up really quickly, Dwayne Wood MD. So if you hop over to our Dwayne Wood MD website, you'll see our free resource that we have made available there. 7 keys to success, 7 keys to success. And that is a free resource that we've made available to you. Learn how successful people create the life they want, because that's what we are in the process of doing. Educating people, empowering them, and encouraging them to take charge of their health, take charge of their life, and create the life they've always wanted. Thank you for being here. We will see you tomorrow at our next episode. Good night, everyone.
Right.